diagnostic for the damage if natural disaster brought to the state. And then, of course, to also look at the level of damage that equipment and infrastructure suffered as a result of this flood. Hospital is a place where you have many people that are immobile, people that are sick. So once there's a disaster in the hospital, it's a concern to everybody. And of course, we have critical. You have also seen some of these equipment. Some of them are so expensive that when exposed to the element, it compromises their functions or even render them useless. So that's why we came to do on-the-site assessment, and then of course to also know what the intervention that we can bring, from the legislative angle. By the time I get back to Abuja, we're going to move a motion for urgent intervention for this hospital. And that's why I came personally, so that it's not somebody reporting to us what has happened. We have seen for ourselves the level of destruction and how the hospital is trying to mitigate by, opening other wards, closing many wards, just to make sure that they conduct minimal operation in the hospital. And with what I've seen, indeed, this hospital needs urgent attention. And going back to Abuja, that's just what we will do.
So, sir, you mentioned that you are coming from Mobi, Adamawa, down to this place, and looking at the way the flood disaster this year is and how it has affected the health sector. What's your major take-home back now?
Yeah, my major take-home, one thing I'm happy is the way this hospital have been positioned. And then the CMD was telling me how patients from different part of Nigeria come here. And of course, other African countries are accessing healthcare here. And this is actually the goal of the committee. When we came into the Stand Assembly, our goal was to reduce medical tourism, or to reverse it rather, making sure that instead of Nigeria going out of the country for medical tourism, people should now be coming from other countries. And the Nigerians that spend billions of naira abroad, the billions of naira should be domesticated here for improving of our healthcare sector. So when I came and he's telling me how many patients were here at Honorable Mota Betara Cancer Center, he was even saying patients come from Sierra Leone, Chad, Niger, and Togo, Benin, and we can't allow such equipment to just lie like that. What happened to the patients? What happened to Nigerians? So this place needs urgent intervention. So we are going to call on the federal government, and so that the intervention can come to this University Teaching Hospital, so that they will begin their operation fully.
Okay, lastly, one of the most of the equipment are damaged, sir, and we don't know, as a representative of the house, will you commit, or will you say that you will go back to the house and see how in the next appropriation are we going to increase the allocation of this teaching hospital?
We are actually having a drive of improving infrastructure and equipment in hospitals. If you will reverse medical tourism, then our hospitals, especially our tertiary health institutions, must actually look like tertiary health institutions. So not only the University of Maiduguri Teaching Hospital, but we want all the tertiary health facilities to really look like health facilities. Aside that, appropriation is one thing, because by the time we get back, the unfortunate thing is the cost of equipment right now, the dollar value. Equipment that were bought before 1 billion naira, right now you can't get them for 4 billion. So that's a huge responsibility. Secondly, we were actually giving marching orders to institutions that any equipment procured, they must have at least 3 to 5 years retainership, maintenance agreement with the manufacturers. Secondly, our people must be trained. Then number 3, which is very, very important, is that all our critical medical equipment must be insured. And what has happened here has underscored the importance of insuring our equipment in all our hospitals. So this is one thing, again, we are going back with it to ensure that it is done.
Thank you.
Thank you.